Go.
Hello, my name is Shay Noblitz. I'm going to be doing the first 4 tests on the shoulder.
That was 3.
What?
You
No,
had
I'm
like a
doing
3.
4. No, I'm doing 4. The first one is the anterior drawer test for the shoulder. Very long name. Curtis here is my victim. So, I'm going to support his arm here, kind of by the elbow, and then I'm going to pull anteriorly, anterior translation, at the humerus head. And you're looking for a click or pain for a positive test, and if it is positive, that means that there's glenohumeral instability or a labral tear. And then the next one is the apprehension test. So he's going to stay laying down. I'm going to support his elbow here, and then lean his arm back and check for apprehension. He's good. Apprehension indicates a positive test, and the pathology would be instability on the anterior side. And then the sulcus sign test, so I'll have you sit up for this one. And I'm going to gently pull down on his shoulder, and I'm checking for any like divot, a dimpling type thing in his shoulder here. It's a little bit hard to put shirt on, but he's normal. Jaden is not, if you want to see one that's not normal. And that would be the instability of the shoulder on the inferior side. And then the last one is the shear test. So this is testing for pain or laxity at the acromioclavicular joint. So you push on his clavicle and the spine of the scapula. Push them together. It's a little bit lax always, but if it hurts, that's bad. That means the acromioclavicular joint place is hurt. That's all.
Dab.
Hello, my name is Curtis. Today I'll be demonstrating the 3 special tests for the rotator cuff muscles supraspinatus and infraspinatus. So the first one I'm going to do is called the bear hug test. So my patient Jared, I'm going to ask. Okay, I'm going to ask you to put your right hand on your left shoulder. I'm going to try to pull you up and away, and I need you to don't grip your shoulder to hold on, but try to resist me.
Okie dokie.
So I'll do that. I'm looking for an inability to maintain contact or weakness for the supraspinatus. And that is the bear hug test. The next one I'm going to have you do is called the Job empty can test. So they're going to extend their arms like this, with the shoulders internally rotated at 45 degrees. And then I'm going to push downwards and I'm going to have you resist me.
I resist.
Like that. And again, you're looking for weakness, and that would be, if there was weakness or difficulty in resisting, that would be pathology in the supraspinatus. And the last one is called the infraspinatus strength test. So you're going to put your arms about a 90-degree angle at the side, and I'm going to try to push inwards, and you need to resist me without letting your elbows flare out. Like so. Good job. And again, if he's unable to resist, or if there's weakness there, that would be a pathology in the infraspinatus. And those are the tests.
Hello, I'm Jared, and today I'll be showing you some special tests on Shay. I guess you can keep your jacket on. First test we're going to do is called the speeds test. So what you're going to have you do is straighten your arm, hold it out, you can hold it a little lower, and then I'm going to resist her movement as she tries to move her hand up, just a little bit. And what I'm looking for here is pain, and the pathology is biceps or labrum. We don't want any of those things. The next one is the Hawkins-Kennedy test. Shay, can you dab for me?
I'll just go like this.
Ah, okay, I get this like this. And what I'm
He's
going to do
always trying to get me to
here
dab in these
is
videos.
internally rotate her arm, because this is testing for impingement of the shoulder. So if there's any pain or clicking or impingement, that's what we're looking for right there in that joint. And then the next 2 we're going to do, please lay down, is the first one is the crank test. So I'm going to take her arm, I'm going to move it all the way up to past 90 degrees, so all the way up to here. I'm going to apply a little bit of axial pressure, and I'm going to do internal and external rotation. And so this is also testing for any pathology in the labrum. And if there's any pain or clicking, that's a positive test. And then fairly similar to it, but this time at 90 degrees, I'm again going to put a little axial pressure on, and I'm going to rotate internally and externally, And this one, if there's any painful clicking, shows you that there's something wrong with labrum. There's my tests.